Begin the ear examination by inspecting the auricle for position, size, and symmetry. Also, inspect the opening of the ear canal for discharge, swelling, or redness. If the patient has complained of ear pain or if you see signs of inflammation, check for tenderness by moving the auricle up and down and pressing firmly on the tragus. Pain on these maneuvers suggests inflammation of the ear canal. Also, press firmly on the mastoid bone behind the ear. Tenderness here suggests middle ear infection. Next, examine the ear canal and eardrum using an otoscope. To do this, select the largest speculum the patient's ear canal will accommodate. Position the patient's head so that you can see through the otoscope comfortably. Grasp the auricle firmly but gently, and in an adult, pull it up, back, and slightly out to straighten the ear canal. Then insert the speculum gently into the ear canal. Note any cerumen or earwax that may impair your view. Also observe for any discharge, foreign bodies, redness, swelling, or scaling. There should be none. Slide the speculum slightly down and forward and maneuver it until you can see as much of the eardrum as possible, including the pars flaccida if possible, and the margins of the pars tensa. Note the color and contour of the eardrum with its distinct cone of light. Normally, the drum is pearly gray. Also, note the position of the handle of the malleus and inspect the short process of the malleus. The handle of the malleus, with the umbo at its tip, crosses the drum obliquely from the cone of light upward toward the short process. Be sure to examine the other ear in the same manner. For the next part of the ear exam, evaluate the patient's hearing. Occlude one of the patient's ears with your finger. Test the open ear by softly whispering numbers or words with two equally accented syllables from 1 or 2 feet away. Test one ear at a time. If hearing loss is present, gradually increase your voice volume until the patient can identify the spoken numbers or words. If hearing is diminished, do the Weber test, which checks for lateralization of bone conduction, and the Rinna test, which compares air and bone conduction. For each test, use a relatively high-pitched tuning fork, such as one of 512 Hertz. To do the Weber test, place a lightly vibrating tuning fork firmly on top of the patient's head. Ask where the patient hears the sound, normally in both ears or the midline. To do the Rinna test, place a lightly vibrating tuning fork on the mastoid bone behind the ear. When the patient indicates that the sound is no longer heard, quickly place the vibrating fork close to the ear canal. Normally, the patient can hear vibration longer through air than through bone. Repeat the test on the other ear.
So which is your better hearing ear?
My righty.
And have you got any pain or tenderness?
No.
And can I get you to give me a smile? By asking the patient to smile, you can look for facial weakness, which is one of the 5 cardinal symptoms of ear disease. The facial nerve runs in the medial wall of the middle ear and may be affected by pathology in the ear. All right, thank you. So I'm now going to start by examining the better hearing ear. First, inspect the external ear, using the light of the otoscope to help. Look at the colour of the skin and the shape of the pinna. Look for other abnormalities such as tophi and congenital defects, and remember to check for scars. Common surgical scars include the end-oral scar between the root of the helix and the tragus, and the post-auricular scar behind the pinna. Next, otoscopy is performed to visualise the external auditory meatus and the tympanic membrane. There are 2 sizes of speculum for the otoscope. Choose the largest size speculum possible for the patient's ear canal in order to maximise the amount of light passing into the ear and to maximise your view of the tympanic membrane. In adults, the largest speculum is usually used. When examining the right ear, hold the otoscope in your right hand. Hold it like a pen balanced between your thumb and index finger. Extend your little finger and use this to rest against the patient's face. This means that if the patient moves his head, your hand and the otoscope will move with it, and the otoscope will not stab into the ear canal and cause pain. This is of particular importance when examining children. With your free left hand, pull the pinner gently upwards, outwards and backwards to straighten the external ear canal to allow a better view of the tympanic membrane. In children, pull the pinner down and back instead. Insert the otoscope into the external auditory meatus and inspect the canal for wax, discharge, inflammation and other abnormalities. Gently proceed down the canal until the tympanic membrane is seen. Move the speculum around to examine the whole of the tympanic membrane and identify the normal landmarks. This is a normal right tympanic membrane. On a normal tympanic membrane, you should be able to see the handle of the malleus, the light reflex in the anterior-inferior quadrant, and the pars tensor. You should look superiorly to see the pars flaccida also. Gently remove the otoscope, continuing to observe the ear canal for any pathology that may have been missed on the way in. Repeat the examination on the other ear. When examining the left ear, hold the otoscope in your left hand, again holding it like a pen between your thumb and index finger, and using your little finger to rest against the patient's cheek. To complete the examination of the ear, the patient's hearing should also be assessed using the tuning fork tests and audiometry. The tuning fork tests are useful in assessing hearing loss. This video shows how to perform Rinne and Weber's tests. These tests are performed using a 512 Hz tuning fork. The tuning fork can be activated by flicking it between your fingers or by tapping the tuning fork on the knee . It is important to explain the test clearly to the patient. So you're going to hear a buzzing. I want you to tell me which position it is louder in. So position A, this tests air conduction, or position B. Bone conduction is tested by placing the base of the tuning fork on any bony area surrounding the ear.
Position A.
When testing air conduction, the tines of the tuning fork should not be held parallel to the external auditory meatus. Instead, they should be held perpendicular to the external auditory meatus and about 1 centimetre from it. Again, it is important to explain the test clearly to the patient. So can you tell me whether you hear the sound loudest in your left ear, your right ear, or whether you can hear it in the middle? Place the base of the tuning fork in the midline.
The middle.